Good afternoon, everyone. This is Michelle Mabley from the American Planning Association, and I'm excited to kick off today's peer call about physical activity. So we'll begin in just a minute, and I want to introduce our speaker today, who is Julia Katz. And she'll be talking about physical activity in clinical community partnerships, and I think there's a lot of great lessons learned from the research and the case studies that she'll be sharing that would be applicable to Plan4Health grantees. So Julia recently graduated from the University of North Carolina at Chapel Hill, earning her master's degrees in public health and city and regional planning. At UNC, Julia focused her research on how to change the built environment to facilitate active living and improve community health. During graduate school, Julia worked at Active Living by Design, where she worked on efforts to develop and sustain healthy communities. Prior to moving to North Carolina, Julia lived in New York City, where she worked to increase retention among tradeswomen, and then later she worked on implementing a national maternal health advocacy program. And very exciting news, next week Julia will begin working at a regional planning organization in North Carolina as the Housing and Community Development Planner. So she's got a lot of great experience, and we're thrilled to have her talking with us today on the peer call. So she'll give a brief presentation, and then we'll open it up to questions and comments from people on the line. So Julia, want to take it away?
All right. Yeah, thank you so much, Michelle. I'm really excited to talk to everyone today. So what I'm going to talk to you about is some research I did in the last few years, and it's been about a year since I really was working on these case studies, but they're still very relevant, and I hope to learn more about them to find out what they've been up to in the next few months. So during graduate school, we all had to do master's projects in urban planning, and I didn't really know what to do, but I really wanted to work with Active Living by Design, which is a nonprofit-like organization in Chapel Hill that works with with organizations around the country that are trying to help communities become healthier. And so I reached out to them to see if they needed any help to do anything, and they did. They were partnering with the Blue Cross Blue Shield North Carolina Foundation, and they needed to learn about a program that Blue Cross Blue Shield was working on. And Blue Cross Blue Shield was partnering with Prevention Institute, who had just developed a thing called the Community-Centered Health Home. And this was an idea that they created which would facilitate public health clinics and community health clinics to work with the entire community, not just their patients. And it was really prevention-based and worked with policy, system, and environmental changes. So Blue Cross Blue Shield was funding different partnerships around North Carolina to implement the community-centered health home model. And they weren't really sure how to do that because it's a pretty brand new idea, and this was in 2012, 2013. And so this model that you see here is the community-centered health home model from the Prevention Institute. It starts with a public health clinic or community health clinic, and the community health clinic partners with community organizations, whether it's a planning department, a school, grocery stores, really could be anything. And that partnership then figures out what the community needs through inquiry. They then figure out what they can change through an assessment, and then they take action and make changes that will then lead to outcomes like improved health and cost savings and evidence-based for effective practice. So what I did for my master's project a few years ago was write a paper about how organizations and how clinics and partnerships can actually implement this and if it's a reasonable model. And through my research and through the work of Blue Cross Blue Shield North Carolina Foundation, they figured that this model actually wasn't the ideal model that they wanted to implement. So now they've actually changed this grant that's still going on to just be called Community-Centered Health Initiative. But I want to show this diagram just to give you a sense of what I was looking for in my research to figure out to identify clinics around the country that were doing this type of work. So I did a lot of research, and I tried to find clinics around the country that implemented something that looked like a community-centered health home model, something that was community-based, not just patient-based, something that was changing policy, system, or environment to improve the community's health. And I was really looking for some clinic or a hospital that had really meaningful collaborations and sustainable changes. And after my paper, I ended up finding about 6 examples that were pretty strong and writing case studies for them that Active Living by Design has published. And so I'm going to really focus on one of those. And it's in Yuma, Colorado. So it's the hospital is called the Yuma District Hospital and Clinic. And I found it really just by searching every possible thing I could find with clinics and hospitals and active living. So I think through this, I Google searched the hospital and clinic and park. And this came up, and I couldn't find anything else about it. And I ended up interviewing the director and different staff members and different collaborators, and wrote a case study about it. And I hope that it's relevant to your work. So Yuma County, Colorado is, it's very, very rural. There's about 10,000 people, which is 4.2 people per square mile. And compared to Colorado's rates, the obesity rates are very high at about 80%. And there's about 33% of the county that does not exercise, which is very high. And Yuma District Hospitals and Clinics is one of 2 hospitals in the county, and it opened in 2007. And as you can see in the median income, it's a pretty low income, pretty poor county. And because there are only 2 hospitals in the county, what's interesting is that you can take the statistics from this hospital and kind of apply it to the whole county. So around 2010, the hospital became a patient-centered medical home, and that allowed them to be funded for different innovative projects. They could hire 2 patient navigators. They have more comprehensive care and had an upgraded electronic health record system. And they got a county health needs assessment, and it was very representative of the community, as I mentioned. It showed actually that there was a lot of people were unhappy with the hospital system. It was in the 30s, I believe. And it found that poverty, obesity, low accessibility to healthy foods, chronic diseases, and lack of physical activity were the main issues in the community. They also saw that, well, as I mentioned, sorry, I mentioned that they already had really low rates of satisfaction. So they knew, the director and the staff knew that people were unhappy and people were unhealthy. And around that time, the CEO of the hospital visited Europe, and he saw exercise equipment in parks. Maybe many of you have seen it, where people can do resistance training all around parks, and there are these really user-friendly equipment. And so he came back to Colorado, and he went to the board of the trustees with the challenge to implement this. And there was one woman who was very excited by this, and her name is Polly, and she was retired. And she knew that there were 5 acres of land adjacent to the hospital, and she thought that that would be a great place to have a park. So she connected with the Colorado Center for Community Development, and they drafted a plan for the park. Um, and she also applied for grants. She took a class on how to apply for grants. She created PowerPoints with some of her friends and other volunteers. And in 2012, the Colorado Health Foundation awarded the hospital with $273,000 to create a health park. And they then implemented a park master plan. It's called the Life Trails at Yuma District Hospital. So this is a draft of what the park was going to look like when they applied for the foundation grant. There are walking trails, 2 gathering areas, shaded areas, fitness stations, shaded fitness areas with exercise stations, bike racks, everything's wheelchair accessible. There's art space, trees and shrubs, vegetable garden area, and sustainable features like earthwork, irrigation, and drainage. And so they actually were able to implement this all. And extra elements that they've implemented are solar lighting so that it's open 24/7. So it's not just for patients, it's for the entire community. Their goal is one of their goals is to increase pedestrian activity, and they found that that has been working. The hospital is in walking distance to schools, senior center, residential areas, stores, and churches. And so people come to the hospital, they walk around the park. There are patient navigators that help them figure out how to use the equipment. There are programs, and many of the programs that they have are just in the early stages, like gardening classes, but they hope to use this park for some pretty cool activities, like adopted grandparent program where the older adults from the senior residential developments nearby come at the same time as the daycare center kids, and everyone works together and plays together. And they're also organizing morning and evening walking groups. So in order to do this, they had to partner with a lot of groups. So they worked with the University of Colorado, the architecture department, the Colorado Center for Community Development, and they got all of their plans for free because students really needed to have like practicum work and create portfolios. So they were able to get that work for free. They also partnered with Live Well Colorado Children's Play Structure and NEOS for the equipment. They partnered with Live Well Colorado, which will help teach individuals and families how to cook and eat healthily by using the gardens. They partnered with Colorado Rural Health Center, who helped them determine what the issues were in the community. And really importantly, there was a new city manager when they were developing the park, and they got him on board. And he's really interested in leveraging the impact of the park by developing plans and securing funding for new bike and walking trails that will connect the health park to other city resources and destinations, like I mentioned. And they also partnered with Improving Communication and Readmission Eye Care, which is developing a statewide health improvement program. And before this call, I wanted to see how the Life Trails Park was going because I haven't talked to anyone in a few months. And I found this flyer which shows that they're really using it, and there's now a Life Trails walking club, and it seems to have sparked interest in physical activity in the community, which I thought was very cool. They're giving everyone pedometers and supporting people at their own pace. So that is something. And so I wrote probably a 5-page case study on this. So if you have any more questions about it, I'd be happy to answer. And I also just wanted to mention another case study I wrote about a clinic in Dorchester, Massachusetts, the Codman Square Health Center, which is a very well-developed, huge force in the community that has a charter school attached to it and has made tons of efforts to improve the health of the entire community. And in terms of physical activity, they partnered with a local fitness organization and they built a community fitness center in the downtown for women and children. And it's 9,000 square feet, a state-of-the-art facility. It has cardio machines, strength training, and a studio for group classes, including, it also has a nursery, so people can bring their kids. And um, it's really interesting. They have a sliding fee scale for as little as $10 a month, youth programs that are low cost, and they even partnered, like, because it's coming out of the health clinic, the doctors and physicians are giving free 3-month prescriptions from the different health centers to encourage women and children to go to the fitness center. So, if you're interested in looking at any of the other case studies, you can go to that link, or go to Active Living by Design, activelivingbydesign.org's website to find it. But I'm happy to answer any questions and talk about this stuff.
Thanks so much, Julia. This is really interesting. I just posted the link to your case studies in the chat box because I'm not sure if it hyperlinks
Great.
from the slide. So we'll open it up to questions, and feel free to just jump on the line and unmute your phone and let us know if you have a question. We'll also, if you would prefer to chat the questions in, that works too. But I'll start with a question. I mean, the Yuma County example is really awesome. It seems like they pulled together so many different partners. And I'm wondering if you could talk a little bit about if you learned through the research about some strategies they used to bring all those coalition partners together. That's something that I'd be interested to hear more about.
Yeah. I think that they had a strong leader, the CEO of the hospital. He was really innovative in his ideas, and he was encouraging the staff and the board to be creative and think outside of the box. And that leadership is really important in order to facilitate these types of changes. And this example, out of all the case studies, was a little different because the partnerships were mostly started by one person, this woman, Polly. And so it's a little different from, and maybe not feasible for all groups, but, and it doesn't really represent all of our best practices that we found. But she was able to do the research and give time to the project, which means that someone also could be hired to take that role, or have a volunteer force. But she went out into the community and tried to connect people. And from what I understand, unlike other groups that are doing this, they didn't have a task force or a formal group of stakeholders in the community. Other groups that we looked at, the way that they created these partnerships was really by formalizing partnerships and creating expectations of people that they really had to be accountable for. I think that's really important, having monthly meetings or whatever is feasible for people, and leaders from other organizations to commit. So one thing that they did in terms of like receiving commitment from community organizations in Yuma, one second, let me just look up the exact language. So in the county, the county started participating, or the city started participating in something called Healthy Eating, Active Living Cities and Towns campaign. And that by joining this group, they received training and technical assistance to help adopt policies that improve access to physical activity and healthy food in their communities. And so as part of that campaign, Yuma City signed a resolution in 2014 that recognized this park as an integral part of the overall program. And so that type of policy change was important. Um, and I guess to go back to your original question about partnerships, I think Polly, the woman who really led this, she she really developed relationships. She started calling the Colorado Health Foundation early on. She worked with the school to get the master plan created, and it seemed to be um, a lot about like relationships and improving the community's health.
Yeah, I think that's a great takeaway and lesson learned because, yeah, it was just this week, one of the Plan4Health grantees from cohort 1, he's posted on the APA website as saying that like projects end, but relationships last. So something like this, we were talking about sort of the programming that went on afterwards. Yeah, the relationships can keep things going and really promote the sustainability. It looks like we have a question from Chad about having places to sit, like park benches, which can make younger people more sedentary. That's an interesting point, whereas older populations may not get out and walk unless they have periodic sitting places. Is there an amount of seating areas or certain distance between seating that promotes the most physical activity as opposed to more sitting? Did you come across anything about research about that, Julia?
Yeah, that's a really great question. I don't know the answer to that, and it is something that is very relevant to parks and really relevant to streetscapes and complete streets, I would say, and just getting people to be able to walk in their own neighborhood, not just in parks, but having benches on sidewalks is really important. And I don't know if there's any research about what the ideal distance is between the sitting places. Sorry, I can't answer that.
Yeah, yeah. Well, it's interesting too because you were saying that they've leveraged the park and they've worked on the ped bike trails to the park, so sort of treating the park almost as a destination rather and building out a bigger network that would maybe promote physical activity in the broader community.
Yeah, definitely.
Yeah. So. It looked like that park design, though. I mean, that was a really interesting image with lots of different things incorporated throughout. So it sounds like they were pretty conscious of things like this, like Chad's question about sort of ideal distances between spaces. And so could you talk a little bit more about sort of the techniques that they used, community engagement to help design the park, or you know, how they transitioned from taking the assessment to moving that into a park design?
Right. So it seemed that, so it's also funny, this is another kind of anomaly in our case studies because the CEO came with this idea and they talked to the board and this one woman took on this project, and it doesn't seem like they did that much community engagement outside of the community health assessment. It does seem that when it seems like it was kind of a park desert though. There's within Yuma, there is a small grid, like urban area, very small. And then other than that, it's mostly farmland, it seems, and like just really rural land. So there isn't a place for people to gather and be active. And um, so I think they saw that as a necessity and they didn't receive that from information from a community meeting. It was like enough people were in the room at the hospital to recognize that. It's kind of I think it was just like an obvious thing. Um, they have worked with local community advocacy and support to make the park more sustainable now that it is a park. So um, they've created volunteer groups to um, to work on maintenance. And I have something like, I think there's an example that one day the tumbleweeds in the park were a big physical barrier. And so the board got group of volunteers and they fixed the problem in a day because people cared about it enough.
Oh.
Um, other than that, the community at the hospital seems to be very excited about it. So the rehab staff is using it to um, just have people work in like realistic and practical environments, like gardening. So you're not just doing rehab work for your arm, like with a weight, but you're going and gardening, or you're going to the fitness equipment in the park.
Mm.
And I think that's creating more excitement around it as well. And there are community garden beds everywhere, and they're trying to facilitate a healthy food education around the park too. So I think that's how they're also engaging the community. Um, yeah.
Yeah, that sounds great. Yeah, it sounds like all of the programming is really activating the space. So that's a great lesson.
And also, because they're trying to attract all the community members, not just patients, they have these patient navigators who are wandering around the park or working in the park all day, and anyone can go up to them and ask questions. It's a really inclusive space.
That's great. So I guess, yeah, again, if anyone else has questions they want to chat in or pipe up, we just have a couple more minutes. But my last lingering question I have is just about generally how community coalitions, much like many of the Plan4Health grantees, I'm wondering if you have any general lessons learned about working with anchor institutions like these community clinics, and I know that sounds like there are some great opportunities there. So if you have any just from this case study or the general body of case studies that you worked on.
Yeah. One of my favorite case study is in Brockton, Massachusetts, right outside of Boston, and it's the Brockton Neighborhood Health Center. They are very involved in the community, and the case study is about it's about a community that needed more healthcare, and perhaps it's because of ACA or just increase in population in the area, but there was a higher demand for healthcare that could be filled, and so they needed the health center had to expand, and they went to the CEO of the health center went to a community meeting, and a grocery store was looking to relocate, and they found a spot where there were two lots, and they said, okay, we found this spot, and we're going to move in with McDonald's. And the health center was like, what? No, we do not want this great grocery store to sit right next to McDonald's. That's going to be terrible for the health of our community and not necessarily that great for the grocery store either. They said, what can we do to prevent this from happening? And the grocery store said, well, you can move in if you want. Like, you can either find another business to move in next to us, but like, that's all you can do. That's what we're going to do. And so the health center just took advantage of this opportunity, and they took place at McDonald's, and they got financed by LISC. There's a co-location fund for grocery stores and health centers. So just, I think, really jumping on opportunities and like having your ear to the ground and listening to opportunities that the community wants and needs, and being an advocate for the community in that way is really cool.
That's awesome. Yeah, it's great to think about diversifying the potential list of partners in communities, and I think these case studies really represent some innovations in cross-sector collaboration. Mm-hmm. So thanks so much for sharing.
Yeah.
And yeah, I put in the link so people can click on this and bookmark the Active Living by Design resources and all of the case studies, so people can refer to these in the future as well. And again, we really appreciate you taking the time, Julia, to share with us about these community-centered community clinical initiatives. Could you remind me what the
Yeah,
acronym?
they're community-centered health initiatives, but you could really call them anything.
Great.
Thank you so much for having me, and I hope this was helpful.
Thanks so much.